Hello there, I'm Tony Meekum, and this is just going to be a quick 10-minute overview through the captivating history of oral radiology. So for those of us familiar with dentistry, it's tough to imagine a world where you can't see beyond what you can see with the naked eye. We use radiology now for diagnosing everything as far as caries, periodontal disease, endodontic lesions, and a myriad of other diseases and conditions. The journey starts with Wilhelm Roentgen's discovery of X-rays in 1895. He was a German physicist who accidentally stumbled upon these mysterious rays, and we'll talk about how that happened. First of all, I want to introduce the Crookes tube. This is William Crookes, a British physicist and a chemist, and he invented this Crookes tube, which is an evacuated glass chamber with electrodes attached to it. It looks somewhat like a steampunk light bulb or something like that. And this was used to experiment on electricity. So it was evacuated. They weren't really sure how electron beams were passing through this. This was also called a cathode-ray tube, and so these cathode rays are basically a stream of electrons that travels through a vacuum. And a lot of scientists back into the 19th century were experimenting on this and learning more and more about electrons and what they were. So Wilhelm Roentgen, as I said, a German scientist, he was using a cathode-ray tube, and he noticed that a fluorescent sheet glowed in the dark nearby. This was a phenomenon that hadn't been described or even discovered before, so it piqued his curiosity, obviously, leading him to explore further. As it cast shadows with this new invisible light, he must have been both amazed and kind of perplexed by what was happening. In his words, it seemed at first a new kind of invisible light. It was clearly something new, something unrecorded. And here we see on the right what's credited as being the first ever X-ray, and that's of his wife Bertha's hand. You could see the bones stand out. It must have seemed just really eerie and bizarre when you'd never seen anything like that. But of course, within a few years, it became apparent to the dental and as well as the medical community the use that this could provide in diagnosing things that could not be seen before without invasive procedures. So Friedrich Otto Walkhoff, he was a German dentist, and he played a big part in the development of the dental X-ray. In 1896, he started experimenting with these Roentgen rays, sometimes they'd call them the X-rays, and he exposed himself. This took 25 minutes to expose his teeth in this imaging plate, and in his words, it was true torture, having to sit there with that thing in his mouth for 25 minutes and be as still as he could. But I felt a great joy at the sight of the results when I became aware of the importance of Roentgen rays for dentistry. So this was a breakthrough that facilitated using dental X-rays in diagnostics. Let's fast forward to Charles Edmund Kells. This is a New Orleans dentist, and he really started utilizing it in practice. In fact, he's credited with being the first dentist to take a dental X-ray on a patient. Kells' determination to explore the potential of these rays led to significant progress in diagnosing dental issues. However, he did pay a high personal cost. Unfortunately, his constant exposure to these X-rays led to the amputation of his hand, arm, and shoulder over time. And despite numerous surgeries and skin grafts, an attempt to alleviate his suffering, after all this physical and emotional pain, eventually the toll on his health and well-being led him to take his own life. So his tragic story is a reminder of the importance of practicing safety measures when working with radiation. Of course, we've learned a lot since then, but today we can honor his legacy by recognizing the need for proper safety protocols and protection while using radiographic technology. As you can see in these images right here, this was before the close of the 19th century. They were starting to really get more diagnostic quality X-rays if you compare to those early ones. Here in 1898, they were already starting to get fairly decent quality radiographs of the dentition. It looks like intraoral exposures here. And as early as 1905, only 10 years after the discovery of Roentgen's X-rays, the first dental X-rays were beginning to be produced. These started to provide dentists the ability to see within teeth and actually start diagnosing caries in areas that weren't visible before. However, these were very dangerous apparatus. As you can see these wires here, these were high voltage wires, so the patient would have to be warned, don't reach up as we're doing this or you might be electrocuted. So that's probably the most immediate threat, but these were also several orders of magnitude more dose than what we expose our patients to nowadays. One interesting thing I'll notice is the geometry, the way these are used, the setup for a intraoral radiograph is pretty much the same as it was 120 years ago. What has been improved is, as I said, the dose is reduced several times over, and the image quality as well. So each generation of improvements reduce the dose by roughly half, and as you can compare with some of those earlier machines, now we see a lot better. And of course we have panoramic machines. Nowadays we have cone beam CTs, and I talk a lot about cone beam CTs in other lectures, but we continually improve our imaging technology. All right, these are some of the review questions that'll hopefully help you drive home the important points of this lecture. We'll go through each of these one at a time with a multiple choice slide so you can see if you remember them. But who's credited with discovering X-rays? In what year were they discovered? What's the name of the device Roentgen was using when he discovered? I guess I just answered that one, didn't I? And a cathode ray is made of what type of particles? So who's credited with it? Hopefully you recognize that one right away. Good name to know. Wilhelm Roentgen, one of my heroes. And when was it discovered? When was X-ray radiation discovered? Was it October 26, 1985? That is an important date in physics history. That's when time travel was first used. But no, it was 1895, November 8th to be precise. And what did Wilhelm Roentgen's first radiograph depict? Was it his own hand? Was it a landscape painting? His wife Bertha's hand? Or a blueprint? That was his wife's hand, showing a ring, if you remember that. What's the name of the device Roentgen was using when he discovered X-rays? Was it cathode ray tube, light bulb, galvanometer, gold foil? That was a cathode ray tube. Also called a Crookes tube, named after the guy who made it, William Crookes. And a cathode ray is what type of particles? Look at that for a second. Hopefully you get it. That is E. So just a quick, brief history of oral radiology. I hope you enjoyed it, and I'll see you next time.